Hi, this is Dr. Machani. I'm an academic internal medicine physician, and today we're going to talk about abdominal pain. The abdomen, a complex region housing vital organs, is divided into 9 areas. The right and left hypochondriac, epigastric, right and left lumbar, umbilical, right and left iliac, and hypogastric areas. Each region can offer critical diagnostic information for abdominal pain. When evaluating abdominal discomfort, assess the location, onset, that is acute or insidious, duration, and character, which is sharp, dull, colicky, or burning. Note the intensity and any exacerbating or alleviating factors. These characteristics help narrow down the differential diagnosis and guide further investigations. Abdominal pain can arise from various etiologies, ranging from benign to severe conditions. It may originate from gastrointestinal disorders such as gastritis, peptic ulcer disease, inflammatory bowel disease, or diverticulitis. Hepatobiliary issues like cholelithiasis and or cholecystitis can cause significant discomfort, particularly in the right upper quadrant. Pancreatic pathologies, including acute or chronic pancreatitis, often present with epigastric pain radiating to the back. Pain may also be associated with urological conditions such as ureteric colic or pyelonephritis. In females, gynecological issues like dysmenorrhea, ovarian cysts, endometriosis, or pelvic inflammatory disease can manifest as lower abdominal pain. It's crucial to consider ectopic pregnancy in women of childbearing age presenting with acute lower abdominal pain. Critical conditions to consider include abdominal aortic aneurysm and aortic dissection. Both life-threatening vascular emergencies requiring immediate medical intervention. Mesenteric ischemia, though less common, is another vascular emergency that can present with severe abdominal pain out of proportion to physical examination findings. Acute appendicitis can elicit right inguinal pain and can present in emergency settings. Red flags include severe persistent pain, particularly if acute and accompanied by back pain, pyrexia, hematochezia, persistent emesis, abdominal distension, or signs of shock such as pallor, diaphoresis, and tachycardia. A rigid abdomen or rebound tenderness may indicate peritonitis, necessitating urgent surgical evaluation. Rapid weight loss, jaundice, or melena are additional concerning features that warrant prompt investigation. The diagnostic approach typically begins with a comprehensive history and physical examination. Further investigations often include hematological and biochemical studies to assess for infection, inflammation, or organ dysfunction. A complete blood count may reveal leukocytosis in infectious or inflammatory conditions, while anemia might suggest chronic blood loss. Liver function tests, lipase and amylase levels can provide insight into hepatobiliary and pancreatic pathologies. Urine analysis is crucial for detecting renal pathologies or urinary tract infections. Positive findings such as hematuria or pyuria can guide further management. In female patients, pregnancy tests are essential to rule out ectopic pregnancy or other pregnancy-related complications. Imaging studies play a pivotal role in the evaluation of abdominal pain. Plain radiographs can identify bowel obstruction, perforation, or the presence of kidney stones. Ultrasonography is particularly useful for assessing the gallbladder, kidneys, and pelvic organs, making it an excellent first-line imaging modality for many abdominal complaints. Computed tomography, which is called CT, provides detailed visualization of abdominal structures and is especially valuable in cases of suspected appendicitis, diverticulitis, or intra-abdominal abscesses. Magnetic resonance imaging, also called MRI, offers superior soft tissue contrast and is often employed when radiation exposure is a concern, such as in pregnant patients. For suspected vascular emergencies like abdominal aortic aneurysm or mesenteric ischemia, CT angiography is the gold standard, providing rapid and detailed assessment of the abdominal vasculature. In cases where gastrointestinal pathology is suspected, endoscopy or colonoscopy may be indicated for direct visualization and potential therapeutic intervention. Treatment modalities vary based on etiology, ranging from pharmacological interventions or dietary modifications to emergent surgical procedures for severe conditions based on the underlying cause. In conclusion, abdominal pain presents a complex diagnostic challenge requiring a systematic approach to evaluation and management. The ability to recognize red flags, conduct appropriate investigations, and initiate timely treatment is crucial for optimal patient outcomes. If symptoms persist or escalate, prompt medical consultation is advised to address potential serious pathologies in their early stages, ensuring the best possible prognosis for patients presenting with this common yet potentially serious complaint. Thank you. Good day.